Have you ever taken a big bite of ice cream and suddenly felt a sharp pain shoot through your teeth? 1 second you're enjoying your favorite dessert, and the next second it feels like your tooth just got attacked by tiny icy needles. If that sounds familiar, don't worry, you are definitely not alone. Millions of people experience tooth sensitivity every single day, especially when eating cold foods like ice cream, drinking iced coffee, or even breathing cold air. But here's the big question: why does it happen? Why do some people enjoy freezing cold desserts with no problem, while others feel instant pain after just one bite? Today, we're going to explore the real reason your teeth hurt when you eat ice cream, what's happening inside your mouth, and most importantly, how you can stop the pain. Let's begin. Your teeth may look super strong on the outside, but they actually have several layers inside them. The outer layer is called enamel. Enamel is like a hard protective shield covering your teeth. In fact, enamel is one of the hardest substances in the entire human body. Its job is to protect the sensitive inner parts of your teeth from heat, cold, pressure, sugar, and bacteria. Under the enamel is another layer called dentin. And inside the center of the tooth is the pulp, where the nerves and blood vessels live. Think of it like this. Your tooth is basically a tiny fortress. The enamel is the strong outer wall. The dentin is the middle layer, and deep inside is the nerve center. When your enamel is healthy and strong, cold foods like ice cream usually don't cause any pain. But when the enamel becomes weak, thin, cracked, or damaged, cold temperatures can travel deeper into the tooth. And once that cold reaches the nerves inside your tooth, ouch! That sudden sharp pain is your tooth nerve reacting to the extreme temperature. It's basically your tooth screaming, "Hey, that's too cold." Now, you might wonder, what causes enamel damage in the first place? Well, there are actually several common reasons, and many of them are things people do every single day without realizing the damage they're causing. One of the biggest causes is brushing your teeth too hard. Yes, seriously. Many people think brushing harder means cleaner teeth, but your teeth are not dirty dishes. If you scrub aggressively with a hard toothbrush, you can slowly wear away your enamel over time. Imagine sanding down a protective wall little by little every day. Eventually, that wall becomes thinner and weaker. And once the enamel gets too thin, sensitivity begins. Another common cause is cavities. Cavities are tiny holes created by bacteria that feed on sugar inside your mouth. When bacteria produce acid, that acid slowly eats through your enamel. As the cavity gets deeper, the tooth becomes more sensitive to cold foods, sweets, and even air. Sometimes people ignore cavities because they don't hurt at first, but later, that small cavity can become a painful problem, especially during ice cream season. Another major cause is gum recession. Your gums normally protect the roots of your teeth, but when gums pull away from the teeth, the roots become exposed. And here's the important part: the roots of your teeth are not covered with thick enamel like the top part. That means they are much more sensitive to temperature changes. So when cold ice cream touches exposed roots, the nerves react immediately. That's why some people feel pain near the gum line instead of the top of the tooth. Now let's talk about another sneaky cause of tooth sensitivity: teeth grinding. Some people grind their teeth during sleep without even realizing it. This is also called bruxism. Grinding creates constant pressure and friction between your teeth. Over time, it slowly wears down the enamel layer. Think about rubbing two rocks together again and again. Eventually, both surfaces become damaged. That's basically what happens to your teeth during grinding. People who grind their teeth may also notice headaches, jaw pain, or flattened teeth, and yes, increased sensitivity to cold foods. Another major problem is acidic food and drinks. Soda, energy drinks, lemons, sports drinks, and even some fruit juices contain acid that weakens enamel. Every time acid touches your teeth, it softens the enamel slightly. Now here's where it gets worse. If you brush your teeth immediately after drinking acidic beverages, you may actually scrub away softened enamel faster. That's why dentists often recommend waiting around 30 minutes after acidic foods before brushing. Pretty surprising, right? Now let's talk about what actually happens the moment ice cream hits a sensitive tooth. This part is fascinating. Inside the dentin layer are thousands of microscopic tiny tubes. These tubes connect directly to the nerves inside your tooth. When cold temperatures enter through exposed dentin, fluid inside those tiny tubes moves rapidly. That sudden movement stimulates the nerve endings, and your brain interprets that signal as pain. So technically, the pain isn't really coming from the ice cream itself. It's your nerves reacting to sudden temperature changes inside the tooth. That's why the pain usually happens instantly and disappears quickly, although sometimes it can linger longer if the sensitivity is severe. Now here's an important question. Does tooth sensitivity always mean something serious? Not always. Sometimes sensitivity is temporary. For example, after whitening treatments, dental cleanings, or eating lots of acidic foods. But if the pain happens often, becomes stronger, or affects specific teeth repeatedly, it's a good idea to visit a dentist because sometimes sensitivity can be a warning sign of deeper problems like cavities, cracked teeth, gum disease, or infections. Ignoring the pain won't make it disappear. In fact, dental problems usually become worse over time if untreated. Now, the good news is there are many ways to reduce tooth sensitivity and protect your enamel. Let's start with brushing. Dentists recommend using a soft bristled toothbrush. Soft brushes clean your teeth effectively without damaging enamel or gums, and when brushing, use gentle circular motions instead of aggressive scrubbing. Remember, gentle is better. Next, choose toothpaste designed for sensitive teeth. Sensitive toothpaste contains ingredients that help block pain signals traveling from the tooth surface to the nerves. Over time, these toothpastes can significantly reduce sensitivity, but don't expect instant magic overnight. Usually, it takes several days or weeks of consistent use to notice improvement. Flossing is also extremely important. Many people skip flossing because they think brushing is enough. But plaque and bacteria love hiding between teeth where toothbrushes can't reach. If plaque builds up near the gums, inflammation and gum recession can happen. And remember what exposed roots cause: sensitivity. So flossing helps protect both your gums and your enamel. Now let's talk about food choices. If your teeth are sensitive, try limiting acidic drinks and sugary snacks. That doesn't mean you can never enjoy soda or sweets again. It just means moderation matters. Drinking water after acidic beverages can help rinse away acids. Using a straw may also reduce direct contact between acidic drinks and teeth. Another helpful tip is avoiding extremely hot and cold foods back to back. For example, drinking hot coffee immediately before ice cream can stress sensitive teeth even more. Temperature extremes can sometimes trigger stronger reactions. If you grind your teeth at night, your dentist may recommend a night guard. A night guard is a protective device worn during sleep that prevents teeth from grinding against each other. Think of it like a helmet for your teeth, protecting your enamel while you sleep. And for people with severe gum recession or enamel damage, dentists may offer treatments like fluoramide applications, bonding, sealants, or gum procedures. Modern dentistry has many ways to help sensitive teeth feel better again. Now let's clear up a few myths. Myth number 1. If sensitivity comes and goes, it's not important. False. Sensitivity can be an early warning sign. Catching problems early usually means simpler and less expensive treatment. Myth number 2. Only old people get sensitive teeth. Also false. Teenagers and young adults can absolutely develop sensitivity, especially from aggressive brushing, acidic diets, or poor oral hygiene. Myth number 3. You should stop brushing sensitive teeth. Definitely false. Sensitive teeth still need proper cleaning every day. In fact, avoiding brushing can lead to more plaque, more cavities, and even worse sensitivity later. Now here's something many people don't realize. Stress can also affect your teeth. When people are stressed, they may grind their teeth more, clench their jaw, bite nails, or neglect oral care routines. All of these habits can contribute to dental sensitivity over time, so taking care of your overall health also helps your teeth. Pretty interesting, right? Now imagine your teeth like armor. Every day, your enamel protects you from hot coffee, cold ice cream, crunchy chips, sugary candy, and millions of bacteria. That's a tough job, and unlike skin, enamel cannot fully grow back once it's badly damaged. That's why protecting it early is extremely important. The small habits you do daily matter more than you think. Gentle brushing, flossing, drinking water, regular dental checkups, using Floramid toothpaste. All these small actions work together to keep your teeth healthy and comfortable. And yes, they help you enjoy ice cream without pain. So let's do a quick recap. Why do your teeth hurt when you eat ice cream? Usually because cold temperatures reach sensitive nerves inside the tooth. And this often happens when enamel becomes damaged. Gums recede or roots become exposed. Common causes include brushing too hard, cavities, teeth grinding, acidic foods and drinks, gum recession, poor oral hygiene. The good news: tooth sensitivity can often be improved with proper dental care and healthy habits. Using soft toothbrushes, sensitive toothpaste, flossing daily, reducing acid exposure, and visiting your dentist regularly can make a huge difference. And remember, pain is your body's way of sending a message. Your teeth are trying to tell you something, so don't ignore it. The earlier you take care of sensitivity, the easier it is to protect your smile, because nobody wants to fear ice cream forever. Thanks for watching. And if you enjoyed this video and learned something new today, make sure to like, subscribe, and turn on notifications for more fun and educational dental videos. Your teeth will thank you later.